Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Methotrexate. Its brand name is Otrexup. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So methotrexate is an anti-metabolite that interferes with DNA synthesis, repair, and cellular replication by inhibiting dihydrofolate reductase. In terms of indications for use, we see methotrexate used in the treatment of severe psoriasis. We also see it used to treat severe rheumatoid arthritis in patients who have not had the necessary benefits from first-line therapy, or if they were intolerant to first-line therapy. This may include high-dose NSAIDs, or non-steroidal anti-inflammatory drugs. Methotrexate can be used to treat juvenile idiopathic arthritis, and it can also be used to treat acute lymphoid leukemia in combination with chemotherapy. Now, before somebody was to use methotrexate, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to methotrexate or any other component of the product, they would not be able to use this medication. If a patient had alcoholism, alcohol liver disease, or chronic liver disease, this medication would also be contraindicated. It would not be able to be used during breastfeeding or in patients who have evidence of immunodeficiency syndromes. It will be contraindicated in patients who have pre-existing blood dyscrasias, such as leukopenia. And lastly, it will be contraindicated in patients who are pregnant who have non-malignant diseases. Now, in terms of precautions, it should be noted that improper dosing of the oral solution may lead to serious adverse effects, including fatalities. If a patient inadvertently receives the once-weekly formulation on a daily basis, this would also lead to potential fatal toxicity. It's very important to note to patients that alcohol cannot be used with methotrexate. It's not recommended to use high-dose NSAIDs or non-steroidal anti-inflammatory drugs with methotrexate. Dehydration associated with vomiting and diarrhea may occur with the use of methotrexate. The medication may have to be discontinued until this resolves. There's a risk of anaphylaxis or other hypersensitivity reactions with the use of methotrexate, and the medication would typically be discontinued at the first sign of anaphylaxis. Nephrotoxicity, including acute renal failure, may occur, especially with high doses of methotrexate. And finally, we mentioned that this medication is contraindicated in pregnancy, but it's also to be noted that a female should wait at least 6 months before conceiving after using methotrexate. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use methotrexate, the dosing schedule that they use and the formulation they receive will depend on what they're using it to treat. If somebody is using methotrexate to treat severe psoriasis, they may use 10 to 25 milligrams subcutaneously once a week. They would then adjust the dose gradually for an optimal response, not to exceed 30 milligrams weekly. After optimal response with treatment with methotrexate, oftentimes the physician will drop the methotrexate and go back to conventional therapy. For severe rheumatoid arthritis, patients may initially receive 7.5 milligrams subcutaneously once a week, and then again individualize and adjust the dose gradually for optimal response. Once the dose exceeds 20 milligrams per week, there's more of a risk of toxic adverse effects. As with all medications, there are some side effects or adverse reactions that patients may experience while using methotrexate, so I'll go over some of those here now. Patients may experience alopecia, a burning sensation, a rash, as well as photosensitivity. In terms of gastrointestinal side effects, patients may experience abdominal pain or diarrhea. Indigestion, nausea, vomiting, and stomatitis are possibilities. Some patients may have abnormal liver function tests or experience thrombocytopenia. Patients may experience bronchitis or nasopharyngitis, and about 1.5% of patients may experience a headache. Now, some more rare but serious side effects would be dermatological reactions such as Stevens-Johnson syndrome or toxic epidermal necrolysis, a granulocytosis, aplastic anemia or leukopenia, and finally hepatotoxicity, renal failure, or pulmonary toxicity. That's all we're going to talk about today with methotrexate. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description. You can check it as well. For today, take care.